So I'm going to present to you, as you said, I'm Oriana, and I'm going to present to you the research that I did with my supervisor, Dr. Sarah Schrader, for my master's thesis, where we focused on assessing the effects of urban living on infant and maternal health through dental stress markers. A little trigger warning: in this presentation, you'll see pictures of human remains. So, to put things into context, during the Middle Ages and after this period of time, European towns went through a major process of urbanization, in which cities grew their population in an unprecedented way. For example, the video that you're seeing right now shows the process of urbanization of Amsterdam, a city that doubled its population during the 17th century, becoming one of the most densely populated cities in Europe at the time. Something similar happened to other cities in the Netherlands, and this new way of living had consequences in people's health, as densely populated cities with lack of sanitization systems became ideal for the spread of plagues and infectious diseases. So what osteoarchaeologists do is to assess the effects of urbanization through bones by comparing physiological stress markers between urban and rural individuals. Particularly for the Netherlands, these studies have shown similar health conditions for urban and rural individuals during medieval and post-medieval times. This doesn't mean that they were both living great lives, quite the opposite. They were both in bad health conditions. However, these studies have focused mostly on adult individuals, leaving out important information about how urbanization affected more vulnerable components of society, such as infants and their mothers. So my research tries to answer precisely this question: how did urban living affect infant and maternal health in the Netherlands during post-medieval times? To do so, we compared dental stress markers of non-adults between urban and rural post-medieval populations. And yes, I said dental stress markers, but why teeth? Well, one of the issues why non-adults are understudied is because their bones are more prone to degradation than adult bones. Because of this, it is often difficult to study health conditions of the youngest individuals. Teeth, because they are made of a way more resistant material, they are less likely to degrade in archaeological contexts. Also, an important factor of teeth is that they do not remodel throughout an individual's life. So pathological conditions remain marked on tooth's enamel as a permanent record of any stressful event. And finally, teeth are the only material that can provide a link to maternal health, because enamel starts to form in utero as early as 5 weeks into pregnancy. So which dental stress marker are we looking for? We're looking for linear enamel hypoplasia, or LEH, to make things easier for everybody. And this dental stress marker is a developmental defect, which means it forms in utero, or well, it forms when the tooth is forming. And it's a non-specific stress indicator because we don't know exactly what causes this stress defect, but it has been linked to nutritional deficiencies, dietary restrictions, and infectious diseases. Specifically for milk teeth or deciduous teeth, this has been linked to vitamin D deficiency in mothers during pregnancy, as well as infectious diseases, fevers, and other type of infections. I'm gonna try to put the laser so you can see it. So when a stressful event happens in our body stops forming the enamel so it can fight the disease. And this is a systemic event, as you can see, because it happens through all the teeth. And, okay, great. Because we know exactly when teeth form, we can know if the developmental defect happened in utero or after birth. So yeah, what I did was I used this methods, a combination of macroscopical methods, which are non-destructive, and they were created by these people, Goodman and Rose in 1991, and Blakey and Armelagos in 1985. And for these, you have to measure with a caliper the distance between the cemento-enamel junction, which is, I'm gonna use the laser again, hopefully nothing will happen, okay. So it's the border of the root of the teeth towards the LEH, towards the defect. And you measure this to know if the defect happened in utero or after birth. I used this formula with data that was already provided, and I did it in these two collections of individuals. As I said, I was going to use a collection of urban individuals and rural individuals. So the collection of urban individuals came from Arnhem, which was a Dutch city. Well, it's still a Dutch city, but it doubled its size during this period of time. And Middenbeemster is the rural site that stayed as a rural site to this day. And the individuals come from lower socioeconomic classes, and for the Middenbeemster, they come from all socioeconomic classes. However, most of the individuals are from middle lower classes. So these two populations are comparable. I analyzed a total of 79 non-adults from 0 to 12 years of age, and a total of 857 teeth from 322 from Arnhem and 535 from Middenbeemster. And the results from this research show us that infants living in Dutch cities during the post-medieval period were more vulnerable to physiological stress than their rural counterparts. In addition, the time at formation of deciduous teeth shows that in both sites, individuals were exposed to more chronic physiological stress during the prenatal period than in their first years after birth. So the higher prevalence of deciduous LEH in Arnhem compared to Middenbeemster suggests that urban environments were tougher specifically for infants and pregnant mothers during post-medieval period. And this is no surprise, because when we hear about post-medieval period, we see all of these types of pictures. If we link these results to the historical context at the time, we can make inferences towards what could be causing higher LEH in urban infants related to maternal health. First, infection diseases were both common occurrences in rural and urban areas. In cities, these diseases appear to be more related to airborne infections due to conglomerate living spaces, air, water pollution, etc. While in rural areas, the main hazards were gastrointestinal diseases related to cattle and water pollution. So in relation to nutritional deficiency, it is likely that women in Arnhem were lacking vitamin D due to their lower wages and working conditions, which kept them in horrible environments. And women from the rural areas were more likely to receive sunlight. So it is clear that there is still more studies to be done, and this study can be complemented with more research. But it is clear, as a conclusion, you can say that you can actually see the maternal stress through dental stress markers of deciduous teeth. So yeah, that is everything for now. Here are some references and acknowledgements. Thank you to the Middenbeemster Society, which has provided a lot of information to making this research possible. And here's some links to the videos that you watched. And yeah, if you have any questions, you can always put them in the Q&A. Thank you.